South Dakota Free CNA Practice Test with answers 180 questions full review. Question 1. Where should the nursing assistant attach a Foley catheter drainage bag? Option A. To the side rail of the bed. Option B. To the headboard. Option C. To the bed frame. Option D. To the resident's four-pole. The correct answer is option C. To the bed frame. The bag must be attached to a non-moving part of the bed below the level of the bladder. Question 2. Which of these is a safety guideline for a resident using oxygen? Option A. Light candles to create a relaxing environment. Option B. Ensure electrical equipment is in good repair to prevent sparks. Option C. Encourage the resident to remove the mask during meals. Option D. Allow the water in the humidity bottle to run dry. The correct answer is option B. Ensure electrical equipment is in good repair to prevent sparks. Oxygen supports combustion. Sparks from faulty electrical equipment can cause a fire or explosion. Question 3. When performing an occupied draw sheet change, what should the assistant do before turning the resident? Option A. Raise the head of the bed to 90 degrees. Option B. Loosen the sheet and roll it toward the resident. Option C. Place and tuck in the clean draw sheet on the working side. Option D. Remove all pillows from the room. The correct answer is option C. Place and tuck in the clean draw sheet on the working side. Preparing the clean side of the bed before turning the resident makes the process faster and more comfortable. Question 4. A cold compress should initially be checked after how many minutes? Option A. 1 minute. Option B. 5 minutes. Option C. 10 minutes. Option D. 20 minutes. The correct answer is option B. 5 minutes. Frequent skin checks are necessary to ensure the cold is not damaging the tissue. Question 5. If a nursing assistant is asked to calculate intake in milliliters, how many milliliters are in 1 ounce? Option A. 10 milliliters. Option B. 15 milliliters. Option C. 30 milliliters. Option D. 60 milliliters. The correct answer is option C. 30 milliliters. 30 milliliters per ounce is the standard conversion factor used in medical documentation. Question 6. When measuring urine output in a graduate container, how should the container be positioned? Option A. Held in the air at eye level. Option B. Placed on the floor. Option C. Placed on a flat, level surface. Option D. Tilted slightly to see the numbers. The correct answer is option C. Placed on a flat, level surface. A level surface is required to get an accurate reading of the fluid volume. Question 7. A nursing assistant identifies a resident is choking because the resident is doing what? Option A. Coughing loudly. Option B. Grabbing their throat. Option C. Talking in a high-pitched voice. Option D. Drinking water very quickly. The correct answer is option B. Grabbing their throat. The universal sign for choking is grabbing the throat with one or both hands. Question 8. When assisting a resident to stand on a scale, what should the assistant do first? Option A. Move the weight to 100 pounds. Option B. Move the weight to 0. Option C. Ask the resident how much they think they weigh. Option D. Have the resident take off their shoes. The correct answer is option B. Move the weight to 0. The scale must be zeroed to ensure the final weight reading is accurate. Question 9. Anti-embolism stockings should be applied when the resident is in what position? Option A. Sitting in a wheelchair. Option B. Standing up at the bedside. Option C. Lying in bed with feet elevated. Option D. Walking in the hallway. The correct answer is option C. Lying in bed with feet elevated. Stockings are easiest to apply and most effective when the resident has been lying down and leg swelling is minimal. Question 10. How many times should each exercise be repeated during passive range of motion? Option A. 1 time. Option B. At least 3 times. Option C. At least 10 times. Option D. Until the resident says to stop. The correct answer is option B. At least 3 times. Repeating the motion at least 3 times helps maintain joint flexibility. Question 11. What is the correct angle for semi-Fowler's position? Option A, 10 to 20 degrees. Option B, 30 to 45 degrees. Option C, 60 to 90 degrees. Option D, 100 degrees. The correct answer is option B, 30 to 45 degrees. Semi-Fowler's is a common position for resting and preventing aspiration. Question 12. When walking with a resident using a gait belt, where should the nursing assistant stand? Option A, in front of the resident. Option B, at the resident's side or slightly behind. Option C, 3 feet away from the resident. Option D, behind the resident with both hands on their shoulders. The correct answer is option B, at the resident's side or slightly behind. Standing to the side and slightly behind provides the best support if the resident stumbles. Question 13. When transferring a resident from a bed to a wheelchair, where should the wheelchair be positioned? Option A, at the foot of the bed. Option B, on the resident's weak side. Option C, on the resident's strong side. Option D, 2 feet away from the bed. The correct answer is option C, on the resident's strong side. Transferring toward the strong side allows the resident to use their functional limbs for support. Question 14. When feeding a dependent resident, at what angle should the resident be positioned? Option A, flat on their back. Option B, minimum of 30 degrees. Option C, minimum of 60 degrees. Option D, standing up. The correct answer is option C, minimum of 60 degrees. An upright position is necessary to prevent choking and aspiration during feeding. Question 15. What should a nursing assistant do to protect dentures from damage during cleaning? Option A, hold them with a pair of pliers. Option B, line the sink with a towel or fill it with water. Option C, clean them over the floor. Option D, only use hot water. The correct answer is option B, line the sink with a towel or fill it with water. Patting the sink prevents the dentures from breaking if they are accidentally dropped. Question 16. When log rolling a resident with hip fracture precautions, you should do what? Option A, use at least 2 people. Option B, roll the resident onto the injured side. Option C, keep the head of the bed at 45 degrees. Option D, twist the resident's spine slightly. The correct answer is option A, use at least 2 people. Log rolling requires multiple staff to keep the resident's head, spine, and legs in perfect alignment. Question 17. How often should oral care be performed for an unconscious resident? Option A, once per shift. Option B, every 2 hours. Option C, every 8 hours. Option D, once a day. The correct answer is option B, every 2 hours. Unconscious residents cannot swallow saliva or take in fluids, leading to rapid mouth dryness and bacterial growth. Question 18. When giving a back rub, the assistant should apply lotion starting where? Option A, from the neck down to the shoulders. Option B, from the buttocks to the back of the neck. Option C, only on the lower back. Option D, on the arms and legs first. The correct answer is option B, from the buttocks to the back of the neck. Stroking upward from the buttocks toward the neck helps promote circulation toward the heart. Question 19. If you notice redness or skin breakdown during a back rub, what should you do? Option A, rub the reddened area longer to increase blood flow. Option B, apply more lotion to the area. Option C, do not rub the reddened area and report it to the nurse. Option D, cover it with a band-aid. The correct answer is option C, do not rub the reddened area and report it to the nurse. Massaging a reddened area can cause further tissue damage to a suspected pressure injury. Question 20. When providing foot care, how long should the feet be soaked in warm water? Option A, 1 minute. Option B, 5 to 10 minutes. Option C, 30 minutes. Option D, 1 hour. The correct answer is option B, 5 to 10 minutes. Soaking for a short period softens the skin and nails without causing excessive pruning or damage. Question 21. When dressing a resident with hemiplegia, which side should be dressed first? Option A, the strong side. Option B, the weak side. Option C, it does not matter. Option D, the side the resident chooses. The correct answer is option B, the weak side. Dressing the weak side first allows for easier manipulation of the garment over the restricted limb. Question 22. When shaving a resident with a razor blade, in which direction should you shave? Option A, against the direction of hair growth. Option B, in the direction the hair is growing. Option C, in a circular motion. Option D, from side to side. The correct answer is option B, in the direction the hair is growing. Shaving in the direction of hair growth reduces skin irritation and the risk of ingrown hairs. Question 23. When providing perineal care for a female, in which direction should you wash? Option A, from back to front. Option B, from front to back. Option C, in a circular motion around the vagina. Option D, from the thighs toward the labia. The correct answer is option B, from front to back. Washing from front to back prevents fecal matter from entering the vagina or urinary tract. Question 24. When cleaning the anal area during perineal care, you should wash in which direction? Option A, from the rectum toward the vagina. Option B, from the front toward the back. Option C, from side to side. Option D, only in circular motions. The correct answer is option B, from the front toward the back. Cleaning from front to back ensures that bacteria is moved away from the cleaner areas of the body. Question 25. When using a fracture pan, which side should be placed toward the back of the resident? Option A, the deep side. Option B, the flat side. Option C, the side with the handle. Option D, the side with the splash guard. The correct answer is option B, the flat side. The flat, thinner end of a fracture pan is designed to slide easily under the resident's buttocks. Question 26. After collecting a stool specimen, what should the nursing assistant do with the specimen cup? Option A, leave it on the resident's bedside table. Option B, place it in a transport biohazard bag. Option C, put it in the refrigerator with the resident's food. Option D, carry it uncovered to the laboratory. The correct answer is option B, place it in a transport biohazard bag. Biohazard bags protect staff from contamination during the transport of specimens. Question 27. When assisting a client in learning to use a walker, it is important to do what? Option A, stand behind him and use a transfer belt. Option B, put padding all the way around the top rim. Option C, let him walk by himself to gain independence. Option D, let him practice for the first time on the day of discharge. The correct answer is option A, stand behind him and use a transfer belt. A transfer belt allows the assistant to stabilize the resident if they become unsteady while using the walker. Question 28. The term urinary retention refers to which of the following? Option A, a normal output of urine. Option B, an inability to urinate. Option C, incontinence or leaking of urine. Option D, a very large output of urine. The correct answer is option B, an inability to urinate. Urinary retention is the inability to completely empty the bladder, which can be a medical emergency. Question 29. Normal hearing loss in aging is usually related to the ability to hear what? Option A, high-pitched sounds. Option B, loud sounds. Option C, all sounds equally. Option D, rapid speech only. The correct answer is option A, high-pitched sounds. Presbycusis, or age-related hearing loss, typically affects the ability to hear higher frequencies first. Question 30. What is the best way to safely identify your patient? Option A, asking for his name. Option B, calling his name and waiting for a response. Option C, checking the bed plate. Option D, checking the name tag or identification band. The correct answer is option D, checking the name tag or identification band. Using a formal identification tag ensures you are providing care to the correct individual. Question 31. Mrs. Jones is on a bowel training program but has not had a bowel movement for 3 days. What should you do? Option A, report it to the charge nurse. Option B, give the patient an enema. Option C, offer her prune juice immediately. Option D, increase her fluids yourself. The correct answer is option A, report it to the charge nurse. The nursing assistant must report the status to the nurse, who will then decide on the appropriate medical intervention. Question 32. The proper medical abbreviation for before meals is what? Option A, PC. Option B, BID. Option C, AC. Option D, TID. The correct answer is option C, AC. The abbreviation AC stands for anti-SIBOM, meaning before meals. Question 33. What is the proper medical term for high blood pressure? Option A, diabetes. Option B, hypertension. Option C, hypotension. Option D, cerebrovascular accident. The correct answer is option B, hypertension. Hypertension is the clinical term for blood pressure that is higher than the normal range. Question 34. A patient who has difficulty chewing or swallowing will need what type of diet? Option A, clear liquid. Option B, low residue. Option C, a bland. Option D, mechanical soft. The correct answer is option D, mechanical soft. Mechanical soft diets involve foods that are chopped, ground, or blended to make them easier to process. Question 35. To help an Alzheimer's resident feel more independent when they cannot find their room, you should do what? Option A, scold her and tell her to stay in her room. Option B, ask her roommate to watch her. Option C, place a familiar object outside her room door. Option D, write the room number on a piece of paper. The correct answer is option C, place a familiar object outside her room door. Visual cues help residents with memory loss navigate their environment more successfully. Question 36. How often should a resident's intake and output records be totaled? Option A, once each shift. Option B, twice a day. Option C, every 4 hours. Option D, every 12 hours. The correct answer is option A, once each shift. Totaling records at the end of each shift allows the healthcare team to monitor fluid balance throughout the day. Question 37. Which of the following should you observe and record when admitting a client? Option A, color of the stool and amount of urine voided. Option B, how much the client has eaten and drunk. Option C, bruises, marks, rashes, or broken skin. Option D, insurance information. The correct answer is option C, bruises, marks, rashes, or broken skin. Identifying pre-existing skin conditions upon admission is vital for accurate care planning and documentation.